and those early days were very exciting because, as George said, we were working out totally new ways to do clinical trials at, effectively warp speed compared to the ways it was done before. And that was really important because we couldn't launch the product. And I was absolutely adamant on this. And when we met, that we have to do the science first before we start giving advice to people, which is very different to the way other companies in this space have traditionally run it. We're going to be producing this data on a sort of logarithmic scale greater than anything that's ever been done in the history of nutrition, probably all the nutrition studies put together. And I think this is really important because it means that suddenly you move from these very crude estimates of what's going on in people's health to much more precise estimates that can go down to the individual.
Hi, and welcome to today's ZOE podcast. I'm your host, Jonathan Wolf, co-founder and CEO of ZOE. And today I'm joined by my two guests and fellow ZOE co-founders, George Hadjigeorgiou and Professor Tim Spector. The question we get asked all the time is, what's ZOE and what are we trying to achieve? How come we're a company, but we're actually publishing all this publicly available science? Why did we get the whole company to launch a not-for-profit app to fight COVID last year? And why are we running what's turned out to be the world's largest scientific study of food and the links to gut microbiome and health? I've asked my co-founders here today to answer those questions and more. On today's episode, we'll be sharing an inside look at why we created ZOE, the scale of the global health problems that we're trying to solve, and our vision for the future of health. Firstly, we have George. George has been my friend now for over 15 years since we worked together at Yahoo. And since then, he has built multiple consumer internet companies. George studied at Tufts and MIT. And we also have Tim. Tim is Professor of Genetic Epidemiology at King's College London. He's also one of the top 100 most cited scientists in the world and founder of the Twins UK study, which has been tracking 13,000 twins for over 25 years. Tim is a leading expert on the microbiome and on personalized nutrition. So to kick off, George, maybe you could just start by explaining what are we trying to achieve at ZOE? What's the mission?
Thank you, Jonathan. Hi, everyone. I think the key thing to understand is that ZOE comes from the Greek word zoe, which means life, and it's this name is reflective of the common mission that was set up with Jonathan and team to help people live healthier and happier lives. And we can unpack these two words in a lot of detail. Hopefully, we'll do that in the rest of the podcast. And it's based on a belief, our few beliefs, that first of all, we believe that the food that we eat is the most important medicine that we take, but also we believe that people have the right to understand how their own body works and responds to food and make their own decisions and be in control of their health. Now, what's different about ZOE and our approach is that we're trying to do that with a new, unique approach of collecting large-scale data around our biology, how we respond to food, even around our psychology, and then by applying artificial intelligence and in particular machine learning on a continuous basis, we give to people new novel insights around science so that they can always understand how their own body responds to food and make their own decisions with the latest and most cutting edge science available for the body. And we do that in order to help them find and apply their optimal diet and improve the health and weight. So that's what we set out to achieve with ZOE.
And George, it sounds cool, but also quite complicated. If I had to get you to say in one sentence, what is ZOE? How would you put it?
I would say ZOE is a radically new approach to improve the health of everyone on the planet.
Excellent. And if I gave you a few more sentences to explain what you get as a customer, is it a diet? Is it a microbiome test? How does it work?
Yeah, so we launched our product a few months ago, and it's a test kit, an at-home test kit and personalized program to eat in a better way for your body. You get a test kit at home to analyze your gut microbiome, the bacteria in your gut, but also measure how your blood sugar and blood fat levels change after you eat. We also measure your diet, and then as a result of that, we'll give you a personalized insights report around both how your gut microbiome is, your blood and fat metabolism is, but also more importantly, or as importantly, a personalized app with predictions about many, many different foods in order to empower you to make the right decisions about what and how to eat to optimize your gut and metabolic response to food, which in turn results into less hunger, more energy, better bowel movements, less weight, and over time, better health. So it's a test kit at home and personalized eating program.
Brilliant. And we'll come back to those bowel movements a bit later, which is not something you always hear mixed in with everything else. Brilliant. Thank you. Thank you, George. And Tim, look, we've had a pretty amazing year, right? If we think back over the last 12 months, we've had multiple papers in Nature Medicine, which is one of the absolutely top science journals. We just announced we've raised over $50 million from Nobel Prize winners, from Eli Manning. We've doubled the team to 70 people. And of course, I think most importantly, right, we launched the product in the US, and it's a long way ahead of expectations. It's been an amazing year, but actually this has been quite a long journey. And I think it might be fun to sort of go back to the beginning to how this all started. And I thought actually, Tim, to sort of put you on the spot, can you remember back to when George and I came to visit you in your office 4 years ago, and tell us how you remember this?
Oh, it seems actually like a decade ago, but I do recall it because it was to me it was a rather strange meeting, because I was in my office overlooking the House of Parliament, and you guys came in and said you'd been a few nights before at a talk I was giving in London about my book, The Diet Myth, discussing the microbiome and a bit about personalized medicine, and said you were really interested in forming a company to link the two together, and really wanted to discuss it seriously. But I didn't really take you guys seriously because you were very keen, looked a bit young, and I said I needed lots of money to do this properly. I wasn't just going to do a sort of marketing-led type project. So I didn't really expect to see much more of you, but then you kept knocking on my door and suddenly said, well, actually, we've raised this money. We can do this incredible study. So I had to change my view and say, wow, it's very rare that, you can say to someone, we want to do some serious science, and actually business people go off and raise the money to do that rather than just the puff and the marketing. So so I was, the first impressions weren't always the right ones, and I was very pleasantly mistaken. So, and then you came up with all this cash. So this is a scientist's dream, that actually I can just get on and do this amazing science without all the bureaucracy and hassle of conventional academic routes. So to me, this was the best sort of all my Christmas presents coming at once.
And George, anything you want to add to that sort of story, I guess, from your perspective?
I mean, I vividly remember that meeting, and I remember kind of, it was very different than what it is now, and we've been very like it, actually. I found a team. I also remember kind of in the very beginning, even before meeting team, that our trip to Crete, Jonathan, where and for the guests, we took a trip for 5 days, just kind of like as friends, and kind of in the first day I tried to introduce you to some famous Greek delicacies, including a famous cheese pie that had a lot of sugar on top, and you told me I will never eat this. And that was a big awakening for me in terms of that week I learned through Jonathan more about kind of food, and I started caring a lot about kind of food. I was, many times I've jokingly said that I was caring more about what fuel I was putting in my car around what fuel I put in my body. So anyway, the beginning of that trip was actually what led me to be even more passionate about nutrition, start reading more and finding out that I didn't know anything. And then that led me to also read Tim's book, The Diet Myth. And I think on the back of that, I changed my diet, as you guys know, and lost like 15 kilos of weight, and also drove my cholesterol levels by 40%, and improved my gut bowel movements, which was a big aha moment that something in my gut was working, Tim. So all this that was good.
Actually, I remember now you saying, it's coming back to me now. I think both of you, as usual, discussed your health and bowel problems with me at the time, which I've got used to at the moment, that people just come for a free consultation. But it did strike me that actually you had really already bitten into, the idea of the gut microbiome being so crucial to our health. I think both of you, through different routes, had actually come to that conclusion already. So I didn't have to do much convincing on that front. I think that was really true. And I think the other thing I actually liked about you guys was that you'd made money the conventional way through companies selling software and bits to make other people richer, and had taken a little break and decided to do something that actually had a better aim, that at the end of it, you could tell your kids or grandkids that you did something worthwhile, to me. And that resonated. And I think that's in a way become a bit of the company philosophy, that a lot of the people subsequently joining have had the similar view, that it's not all about making money. It's also, doing something you're proud of and helping other people. So that was great. So, but yeah, it was a great story. And what really got it going was the speed at which we got going, and the energy that we had on that second and third meeting really was palpable. And so we all said, if it's going to work, we've got to get going really fast. And luckily, the combination of the commercial entrepreneurial skills, plus, the fact that we also started with a really good team who have been looking after the twins, doing some similar sort of work, I think really gelled. So we were able to do things at like 10 times the speed that any other group could. I think that was really important.
Jonathan, I remember vividly a story in terms of the beginning of our first PREDICT study, which I think Tim is referencing, where, of course, we were completely naive back then. We're a bit less naive now. We learned a bit in terms of clinical studies and science, etc. And we're still learning. But I do remember vividly in the very first days that I think Tim and many others said, to do a study, we need to hire kind of a CRO. And I think kind of you and I looked at each other and we said, okay, CRO, Chief Revenue Officer, what is that? Like, we don't have a revenue now. Like, why should we hire a CRO? And I think people were referring kind of to the people typically kind of contracted to do these clinical studies. And in the end, after interviewing many people, said, you know what, we can do it better probably. And we used a completely different approach from first principles to set up and run the studies, right? With kind of I think combining the best of kind of, I think Sarah's expertise, like kind of our ability to kind of start companies, but also kind of develop technologies like apps and whatever to run these clinical studies. But I vividly remember that CRO incident because it was like an example of how kind of naive and new we were to this kind of whole approach.
And I think, Tim, it'd be interesting to talk about that for a minute, because I think, my background is really sort of data science, machine learning at scale in the internet, George sort of with all of this consumer internet experience. And so, in retrospect, I think we came into this with a very different set of perspectives than in a sort of traditional science. And I think a set of skills that have turned out to like combine with the sort of approaches that you've been doing for a long time very well. Like, what is new and sort of additive, and how has this enabled us to, I guess, deliver the science so far and where we're going?
I think that it was really the keenness to embrace new technologies and new ways of doing things that got around a lot of the old obstacles of doing clinical trials in a very slow, cumbersome way. Really got rid of paper. The idea of reporting and doing things in a very slow way was overtaken by, the real drive to use apps for everything and get everything in real time. So you didn't then have to check all the data and get people to post their questionnaires back, which up to that point had been the standard way of doing things. So it was, I think, embracing the idea, well, I'm sure we've got enough brains, in this room to solve these problems. We've actually got new methods from the internet and the commercial world that can actually help in this health space. And I think that was really crucial, because we were able to do the PREDICT study, the first 1,000 people in less than a year, that would have taken probably about 5-6 years if we'd used the standard methods and recruitment and gone through all those processes. So I think it was this combination of these there's new ways of thinking at it. Plus also, the fact that when you're in a business, the clock is ticking. So there's everyone's job is on the line if you don't get it done. So there was a huge emphasis.
Only so much money, right? And then it runs out.
Well, that's right. And, promises have been made and whatever. So I think that was really quite fun. And those early days were very exciting because, as George said, we were working out totally new ways to do clinical trials at, effectively warp speed compared to the ways it was done before. And that was really important because we couldn't launch the product. And I was absolutely adamant on this when we met, that we have to do the science first before we start giving advice to people, which is very different to the way other companies in this space have traditionally run it. They've generally just set up some platform to measure your microbes or some blood test. And then after the event, just said, well, other data have shown this is related to so-and-so, and therefore we're going to give you your prediction, which is really second-rate science, and I didn't want to do that. And luckily, both of you were prepared to put the hard hours and graft into getting those foundation studies off the ground. And as you know, not only did they fantastic for these algorithms, but also we found all kinds of new stuff that we didn't expect. And I think keeping that open mind, this sort of agnostic view of what we're going to find has really paid off. And I think that's another philosophy of the company, is that we're going to follow the data, not some particular mindset about diet or health that we may have in our heads that's actually incorrect. And so that's the exciting thing. So every week we find something different, and that makes this whole project very much alive.
And Tim, one of the things that's interesting is that even with that first PREDICT study, was already the world's largest in-depth nutritional research study. And so maybe I guess the first point is, like, how could that be? How could we do something that was already the world's largest? And I think, how could that be? How is this different? But then also, how are we building on that? And how also is that, I think, really different about the way that we think about like big data and scaling data? How does that compare with sort of the traditional science where you've been doing, many of the biggest studies in the world and following twins for all this time? So what is actually sort of different here?
Well, we did one, just to put this in perspective, in 2007, we did one of the biggest genetic studies in the world with 1,000 people in it, and measured the whole, the genome on 1,000 twins and published in the Lancet. And that's a long time ago. And basically nutrition has stood still in that time. And so still a big study in nutrition is like 50 people. And the trials are really small. And
Tim, why is that? Is that because nobody knows that they want to do bigger studies? Like, are there real restrictions, which I think we know is there are real restrictions?
Well, it's a bit of both. It's traditionally no one's done it, no one's broken that mold. So all the journals and the academics don't expect much more than 50 people. So it's like that's what you get. That's seen as what a grant will give you. And that's the speed at which people work. So it's been in a vacuum that this particular field, as opposed to physics or genetics or anything else, has been left behind in the last 20 years and totally underfunded and under-resourced. All the latest science is now pointing to be the most exciting area of science. So, but it's been in this vacuum that our study of 1,000 people ended up being the biggest nutritional study of its kind, which is kind of amazing because that was our pilot study, if you like. And since then, we have now, we've got 5 times that amount of data now, and we're doubling that every few months. So we're going to be producing this data on a sort of logarithmic scale greater than anything that's ever been done in the history of nutrition, probably all the nutrition studies put together. And I think this is really important because it means that suddenly you move from these very crude estimates of what's going on in people's health to much more precise estimates that can come down to the individual. And because my background was in genetics, I realized that numbers were absolutely crucial, and that you couldn't do a genetic study of less than 1,000 people. It's a complete waste of time. And so the same principles should be true for nutrition. So yeah, I think we've broken the mold, and I think set new bars, of which need to be set by everyone else in this field to actually get the real data so we can give real proper advice to people.
And George, just to bring you in here, like, I guess two questions. Firstly, is it normal in your experience, you've been involved in a lot of companies, to have this sort of science underneath it? But then also, like, what have we had to do in order to try and make sure that we didn't just have these discrete studies, like one study and finishes, then another study that doesn't come together, but think about this as this constantly growing way to gather more data from, these participants who have been incredibly generous, right, Tim and George, to do this and contribute data to improve the science. Like, what is this normal, George? And is this how you've done things in the past?
No, it's definitely not normal. I think the approach that we undertook, and of course kind of through both Tim's guidance and also our beliefs, is reflective of the fact that although this is not our kind of first company, we like it to be our last company. That's what we said from the very beginning. And because we're doing this to really kind of have an impact in the world and improve the health of people, we want to set up things in the hard way, but definitely the right way, which is why we set up the foundation of this kind of continuous kind of data collection and discovery process right from the beginning. So because we've set up that foundation from the standardized tests, how we measure different things and how we collect data, so then we can both close the loop, but also compare kind of every person with thousands, tens of thousands, millions, eventually, people in a standardized way. That allows us for ZOE, even when we go beyond the studies and into scaling our commercial and consumer product, to actually be a continuous kind of science project where basically we can both collect data in a standardized way and continuously uncover new insights by connecting the dots. For example, connecting kind of, your microbes to the way you eat, and then the effects basically that has on your gut microbiome is an example of that. So I think this is reflective of this kind of very foundational belief that we had in the beginning of the company around doing things in the hard but right way, which again is reflective about why we're doing this, which, as Tim said, is not about money, it's about actually having an impact in the world and doing something we'll feel proud about.
And Tim, we often hear, scientists good, doctors good, companies bad, right? And that's, I think the story that many of us grew up with, and I think as you picked up earlier, I think for myself as well as George, a big part of this motivation after having done really interesting things before, maybe with a lot of technology, but maybe not changing the world in the way we wanted. Our kids were getting older. We wanted to do something that that they would feel proud about. But what has your experience been like? Because you've now been collaborating very closely, both with this academic hat and also with ZOE, and where, there's a lot of data scientists in ZOE and scientists working in ZOE, and then people also in many academic institutions, right? King's College where you are, but Stanford and Harvard and Mass General Hospital. Like, what has your experience been, of, I guess, like a much closer relationship with a commercial company than previously?
Yeah, well, obviously I've had encounters with other companies in my sort of 30-year career, but absolutely none have come anywhere close to working so closely with ZOE, really because of the shared beliefs that we were actually doing a study together from scratch. And I think that really made a huge difference, that we were designing it together and instantly saw the added value of getting people from other fields involved, because the one thing we've learned is that this is a hugely multidisciplinary area. No one person, no one brain can really have all the facilities to put this together. So you do need all those insights from, people with computing, physics, AI, plus biology and food and epidemiology. And putting those together has been the most amazing journey, really, because that's really showed us how you can progress so much faster than you could in the traditional way with just a few group of scientists in a very narrow field experts. So I think it was the breadth that's given us this advantage, and the fact that we're dealing with an area where really so little is known. So everything we discover about food is often very novel, and so that's, I think, also excited all the staff in the company to become food experts themselves, even if they'd only done computing or astrophysics or something else like this. I think it's converted everybody to this common goal. And the other thing is, things happen much faster in a company than they do in academia. People are used to a speed because there isn't this pressure to write grants and write lengthy papers. You can get so much done. It's done at 2 or 3 times the speed. And I think that's been the exciting area. But clearly, you guys have been selecting the right people to work with. So it's been a fantastic team and experience. But when you're dealing with apps, also the other thing is the regulatory side of things. It's been 10 times faster dealing with a company than it would have been setting an app up in a university situation. And we've learned that with the COVID study app, the ZOE COVID app as well, wouldn't have been possible without the industry connection that, for bizarre reasons in most countries, is much easier to connect with the public than it is through hospitals or universities. And I think that was one of the most exciting things of last year, is how we managed to put our heads together in a crisis in March last year and come up with this amazing app in 4 or 5 days that has got 4.5 million people engaged in it, using much the same principles as we've discussed here.
And I think it's worth, let's stop. So maybe we'll talk about that for a minute more. So we were, I guess, sort of 2.5 years into this journey. We'd completed not only this first study with the twins and some people at Mass General Hospital, we were also just coming towards the end of the second study, Predict 2, another 1,000 people across every state in America. And then suddenly COVID started to happen around us. Maybe we could go back to March and actually maybe George, interested to get your recollection of what happened and what we decided to do. And again, like, why did we do this?
I mean, first of all, Tim came to us with an idea to study, I think, if I remember well, the twins in terms of the symptoms they may develop during this time, and also how can connect those to the real case of COVID, and also what happens afterwards, how severe it is, whether people get hospitalized, even, unfortunately, in some cases die, in order to be able to do, with the same principles of Discover, connecting basically kind of large scale data with kind of symptoms, and then kind of, downstream effects, kind of uncover new insights around science, be able to both predict COVID, but also to kind of detect kind of early symptoms. And I think that you actually, John, said, like, hey, it's a cool idea, but kind of why don't we kind of give it to everyone? And I have to admit, initially I was personally a bit skeptical. I said, okay, will that work? And then we said, what, the hell with it, let's give it a go, and let's kind of get a team, do a hackathon, and kind of launch something very fast, because timing was of the essence. I think we put a time box of a weekend. In the end, it was 5 days. The weekend was probably over kind of stretched. And I do remember that happened on a Thursday. It may have been the 19th of March, if I remember well. And then we launched the app on a Tuesday, which must be the 24th of March, if I remember well. And suddenly, kind of, it became viral, right? And I vividly remember, because I was writing, I have this memory of writing this sharing message, which was around kind of, help share this and kind of save lives, with this emoji of the prey in the end. I remember actually selecting even the color of the emoji, and suddenly it's 1 million people sharing that emoji. I say, what, I was writing that in my bedroom, or my living room, and it's suddenly viral. So I think it was an unexpected kind of success, if I may say, but kind of something that, and I think Tim and you, John, can talk more about kind of the amazing impact it's had since then, but something that was reflective both of our beliefs and our approach in terms of collecting this kind of large-scale data, applying technology, in particular machine learning, and providing kind of real new insights that can actually move healthcare from preventative, in this case predicting COVID, to preventative versus kind of symptom-based, and helping to improve people's kind of health, in this case saving lives with better precaution and planning.
I remember this very well because Tim called me. I was in this office because we'd already moved everybody home, ahead of the government saying, so we'd said everywhere across the US and UK people should work from home. He called me up and Tim would pitch a wonderful, crazy new idea about once a month, right? Many of which were like a bit off the side. And I think, Tim, you were pretty used to me saying, look, no, right? Because actually we've got all this, there's only so much we can do. So I think, Tim, you were really caught out when I said, actually, I think this is a brilliant idea, but rather than doing it just for the twins, let's do this, for everybody, because actually, and I guess this is, sort of my background with very large scale data. This idea, which turned out to work, right? Which is that if you could collect, if you could get millions of people to decide to participate, suddenly you could get this sort of real-time monitoring. And I think the learning that, again, you sort of bring from the internet and our experiences, that the incremental effort to go from supporting 10,000 people to 10 million people actually isn't that big if you have a good engineering team, and we're lucky to have an amazing engineering team. So I think, Tim, you were really shocked, I think, right, to say, let's do this. And I think, in a way, this was a great example, I think, of collaboration between academia and people who are used to doing things, sort of in company and internet scale. And we have also learned a great deal from this. We ended up having, I think, the whole company working on it for a few months, right, George? Because it took off so much that we had all of our resources. I think, Tim, there's been some really great science that came out of it. I don't know if you want to spend a minute just sort of explaining that.
Yes, so it exceeded our wildest dreams, really. So not only 1 million people downloaded in the first 24 hours, but I think 2 million after about 10 days. And just to get millions of people regularly logging their data and giving us millions of healthcare records really showed, the trust that people were putting in us. And I think that was really important. And we also learned how to interact with these people to keep them logging. So the fact we still have up to 1.5 million people logging after a year is a testament to how we've also adapted the app and realized that people want a two-way discussion with their mobile, their smartphone. They don't want a one-way discussion of their data. So I think we've learned masses from that, and I think it's going to change the whole way health research is done in the future. So I think this will probably turn out to be one of the pivotal projects in healthcare research when we look back. And on the way, I mean, there's other videos people can look up about the achievements, but basically we found new symptoms for COVID. We got the government to change their policy. We were able to pick up hotspots of what was going on. We were able to reassure the government that having, spacing out the vaccines was working. And a lot of it was also reassuring the public in times of crisis. And a lot of the really good feeling I got was the feedback we get from all the participants saying how just having regular updates on the data that they trust, that it's not from some newspaper or government they might not have full faith in, was really important. So I think we've published over 20 papers, and there's another 100 academics also behind this project, and it's been this massive people working together for this common aim that's been really, really uplifting, I think. And
Tim,
we were able to do surveys that we weren't able to do as well. So I mean, as an example of how it's changing, we got over 1 million people to fill in a very detailed dietary survey in the space of a week, and that would have taken 5 years in an academic setting to get that kind of data. And so,
and Tim, on that, because I think many of our audience might say, well, that sounds really cool, but it doesn't sound like it's got anything to do with nutrition and gut microbiome and things like this. And now you've just mentioned sort of this eating survey. So, this COVID thing is got anything to do with, what ZOE is really about, or what do you feel?
Well, we went into it without any expectation it would have any link at all. We were just doing our bit for the country and the world as we saw it. But it's turned out that actually nutrition and food is really key to COVID and infections. And it's reinforced my view of how important good quality diets are in terms of your immune system. And therefore, what we're doing with the ZOE nutritional product is going to help protect people against COVID and other pandemics in an important way. And we've got data coming out that if you are in the lower quality, if your food is poor quality, as it is in many parts of the UK and the US, you have a 20% greater risk of being hospitalized with COVID, and you're going to get much more severe forms of it. And you can protect yourself if you're on the good quality end. And so that in 1 million people is a very important finding, which linked to the fact that we found supplements didn't work, and obesity and diabetes and other things associated with your gut health are also risk factors. Put it all together, what we're doing to improve people's health is definitely going to improve their immune systems and reduce the toll of COVID. So it's starting to fit together in a way we didn't really imagine it would have done when we started.
And Tim, since you're talking about eating and changing eating in order to improve your health, which is obviously sort of core, I think, to what's motivating us all. For both of you, how has your own eating changed since starting ZOE 4 years ago?
I've given up my porridge in the morning. So I did various studies looking at different porridges, and none of them really helped me and gave me sugar peaks. I used to have the occasional orange juice. I found that's quite deadly for me. So I've thrown the Tropicana in the bin. And I also much more careful about what I'm eating. And I've swapped, for example, bananas for eating apples and pears because my ZOE score showed they were much better for me. And I'm just much more conscious of what I'm eating and just trying to look for alternatives. And I think I use the ZOE app to try and pick new foods that I haven't tried recently and try to increase my diversity. So yeah, obviously I'm less focused on.
And Tim, I'm smiling because you're like Mr. Diversity compared to the rest of us. So we know that that's like a very high bar compared to George and myself.
It is. But so my breakfast, I think, is the one meal I've changed more than any other, thanks to this. And yeah, and and the paper we had on sugar dips also has changed my way of thinking about snacking. And I think that's important. So I try to have my snacks with my meals rather than completely separate moments. Doesn't mean I cut them out completely. I'm not that much of a saint, but and I think this is very much an ongoing process. So I'm looking to see how my repeat microbiome looks when I retest again in a few months' time.
Amazing. And George, how about you?
I mean, I started this journey as I said, even before ZOE, and of course with ZOE, kind of I've refined it. I think the key things I've changed is I kind of cut out bread completely, and I have a very sweet tooth, so I'm being much more selective around kind of the times I'm having my ice cream. I mean, I love soft serve ice cream, so I haven't completely cut it, but I'm being very selective in having it basically maybe kind of once a month, because again, our philosophy as we discussed is like there's no food off limits, so you can enjoy life. Is messy, you can enjoy some stuff, right? From time to time, but I've definitely cut out kind of sugar, and then I've started to basically experiment more around how I space my meals. I actually eat less now in the morning. I let my body a bit kind of rest after kind kind of, trying to understand how fasting kind of impacts my body in the morning. Try to actually combine, kind of eat whole wheat pasta versus kind of normal pasta, and try to cook it a bit less, and also include certain things that can blunt kind of the sugar response. Try to combine exercise and walking kind of after a heavy meal. So I've changed a bunch of different things, not only in terms of what I eat, but also how I combine exercise and also different foods to be able to kind of, eliminate kind of big kind of blood sugar and kind of fast spikes, but also improve my gut. The one thing I'm still working hard on, I have to say I haven't done a great job yet, is on the diversity angle. Tim talks about it all the time, and he gives me a hard time. So I'm improving, but I'm not quite yet there. Although I'm eating a lot more kind of pulses, lentils, etc., than I used to do before.
And I think one of the interesting things, right, is this is an ongoing journey. So I certainly find this, like, every time we make this new discovery, or there's a new analysis because the data's gone up, and suddenly we find these new things, this newspaper, and so I'm like, oh, I've got to change this. So I feel like I'm sort of constantly chasing this as we understand. And I think the reality, which is important, right, is to say that to recognize we don't understand all of this. So this is definitely sort of the best possible view of the science today. But interestingly, sort of as Tim has been talking about, right, as we scale up more people, we're still discovering a lot of things that we didn't have. So we're almost at the end of time. So just to wrap up, maybe with one final question for the audience. If you put on your glasses and peer into the future, where do you think we will be in 10 years' time? And maybe start with you, George.
So I hope that in, I don't know if it's 10 or 15 or whatever years time, but I hope that we ZOE becomes a platform that empowers through its scientific data many different types of solutions and products that improve people's health, right? And I'll give you just an example to make it real for people. What if, right, a doctor in a remote part of the world could, after kind of a visit of their patient, kind of plug in the blood data, maybe the stool data, etc., and through our algorithms, we help them provide, an app or even kind of insight for this person, again, in this remote part of the world, around kind of their body and also kind of how to eat to actually improve the health. And I think that kind of, in my mind, like, if we can become this product that enables people everywhere on the planet to improve the health in a very empowering way, by understanding the impact of food and in general their body, I think that's kind of where I would hope we are. Again, I'd like to say that in 30 years' time, nobody will think about food like calories, but more about the impact it has on their body.
Brilliant. And Tim?
I'd like to see that in 10 years' time, everyone has the ZOE app on their phone, just like you would have an Uber app in case you needed a cab, because you'll have that every time you go shopping. Every time you think about food, you'd be given suggestions that would move us away from the old-fashioned way of looking at food and start making food think about in terms of how it's going to do for you, how it's going to be for your metabolism, your microbes, but also, I think, increasingly the planet and the environmental aspects of it as well. So that basically this app will be an amazing educational tool for everyone from school kids to grannies, to tell them the truth about food in ways they haven't been told before. And I think that is one of our missions, I think, for the next 10 years, is to really re-educate people about what good food is and how to get more of it. And that should be, a global objective. And I think I can see with the technology advancing and all the success we've had so far, that there's huge popular approval for this approach moving forward. So I think I'm optimistic. I'm seeing a bright future in 10 years.
Brilliant. Well, we'll play this again in 10 years' time, and hopefully we will have achieved both George and Tim's ambition. We're at time. So on behalf of George, Tim, and myself, thank you very much. I hope you've enjoyed this podcast and look forward to seeing you on the next one. Do please subscribe. Bye-bye.